If you have ever donated blood, you probably know that people have different types of blood. Although all blood is made of the same basic elements, not all blood is alike. In fact, there are 8 different types of blood. These types are determined by the presence or absence of certain antigens, substances that can trigger an immune response if they are foreign to the body. Since some antigens can trigger a patient's immune system to attack the transfused blood, safe blood transfusion depends on careful blood typing and cross-matching for antigens and antibodies. Antibodies are made of B cells produced in response to a foreign antigen. Antibodies neutralize or destroy antigens. It is important to know what antigens and antibodies are present in the blood. There are 4 major blood groups determined by the presence or absence of 2 antigens, A and B, on the surface of red blood cells. Group A has only the A antigen on red cells and B antibody in the plasma. Group B has only the B antigen on red blood cells and A antibody in the plasma. Group AB has both A and B antigens on red cells, but neither A nor B antibodies in the plasma. Group O has neither A nor B antigens on red cells, but both A and B antibodies in the plasma. Group O can donate red blood cells to anybody. If you have type O blood, then you are known as a universal donor. In addition to the A and B antigens, there is a third antigen called the Rh factor, which can be either present, positive, or absent, negative. In general, Rh negative blood is given to Rh negative patients, and Rh positive blood or Rh negative blood may be given to Rh positive patients. The universal red cell donor has type O negative blood type. The universal plasma donor has type AB positive blood type. What are some of the disorders that can affect the blood? One common blood disorder is iron deficiency anemia. The body needs iron to make hemoglobin. Hemoglobin gives blood its red color. When the iron level gets low, the patient has what is called iron deficiency anemia. Iron levels might be too low because of heavy menstrual periods, pregnancy, ulcers, colon polyps, colon cancer, inherited disorders, or a diet that does not contain enough iron. Anemia may make the patient feel weak, cold, dizzy, and irritable. Anemia is confirmed with a blood test. Once a patient is deficient in iron to the point that anemia develops, increased intake of iron-rich foods is beneficial, but is usually not enough to correct the problem. The patient needs iron supplementation to build back the iron reserve, as well as to meet the body's daily iron requirements. Iron deficiency cannot be corrected overnight. The patient may need to take iron supplements for several months or longer to replenish the iron reserves. Generally, the patient will start to feel better after a week or so of treatment. Sickle cell anemia is another blood disorder. It is a disease in which the body produces abnormally shaped red blood cells. The cells are shaped like crescents or sickles. These blood cells are more fragile than normal, round red blood cells and are more prone to rupture. Ruptured blood cells, in turn, leads to anemia. The sickle cells can also get stuck in blood vessels, blocking blood flow, which causes pain and organ damage. Sickle cell anemia is caused by a genetic problem. People with sickle cell anemia are born with two sickle cell genes, one from each parent. If the patient has only one sickle cell gene, they have what is called sickle cell trait. About 1 in 12 African Americans has sickle cell trait. A blood test can show if the patient has either the sickle cell trait or the anemia. Sickle cell anemia has no widely available cure. However, treatments can help relieve symptoms and treat complications. The goals of treating sickle cell anemia are to relieve pain, prevent infections, prevent organ damage, and prevent strokes, and control complications if any occur. Blood and bone marrow stem cell transplants may offer a cure for a small number of people who have sickle cell anemia. Researchers continue to look for new treatments for the disease. Here are some key word parts dealing with the blood, along with their meanings. In the third column, you can see some of the medical terms that we can create by combining word parts. You should return to the online medical dictionary to hear the pronunciation and become familiar with the meanings of the created terms. Now let's turn our attention to the lymphatic and immune systems. The organs of the lymphatic system are the lymph nodes, lymphatic vessels, thymus gland, spleen, and the tonsils. The lymphatic system is comprised of a network of vessels whose function is to pick up excess tissue fluid, cleanse it, and return it to the circulatory system. Another function of the lymphatic system is to pick up fats that are absorbed by the digestive system. The primary function of the immune system is to fight disease and infection. Immunity is the body's ability to defend itself against pathogens. Pathogens can be bacteria, viruses, fungi, protozoans, toxins, and even cancerous tumors. There are two forms of immunity, natural immunity and acquired immunity. Let's look at these two forms of immunity in a little more detail. Natural immunity is also called innate immunity. Natural immunity is resistance that one inherits from one's parents. It is not specific to a particular disease and does not require prior exposure to a pathogen or invading organism. An example of natural immunity is when white blood cells ingest any pathogen encountered. Acquired immunity, on the other hand, is the body's response to a specific pathogen. There are two types of acquired immunity: passive acquired immunity or active acquired immunity. Passive acquired immunity is the result of receiving protective substances produced by another human or animal, such as maternal antibodies or antitoxin. One example of passive acquired immunity would include disease resistance obtained by an infant who is fed with breast milk. In contrast, active acquired immunity develops following a direct exposure to a particular pathogen. This stimulated immune response results in a series of mechanisms designed to neutralize the pathogen. When we receive immunizations or vaccinations against, for example, chickenpox or rubella, they are designed to provide us with a type of active acquired immunity. As you can imagine, there are lots of diseases and disorders that negatively affect the lymphatic system. One common condition of the lymphatic system is lymphedema. Edema, or swelling, may happen when there is an increase in fluid in the body or because of a blockage in the lymphatic system. The accumulation of lymph is referred to as lymphedema. The causes of lymphedema include various infections, cancer, scar tissue from radiation therapy, or surgical removal of lymph nodes, and inherited conditions in which lymph nodes or vessels are absent or abnormal. Treatment for lymphedema includes physical methods such as compression stockings and medicines. There's another problem that affects the lymphatic system called tonsillitis. Tonsillitis is the inflammation of the tonsils. The tonsils are two oval-shaped pads of tissue at the back of the throat. There is one tonsil on each side. Signs and symptoms of tonsillitis include swollen tonsils, sore throat, and difficulty swallowing. Most cases of tonsillitis are caused by infection with a common virus, but a bacterial infection may also cause tonsillitis. Appropriate treatment depends on the cause. If tonsillitis is caused by a bacterial infection, the doctor will prescribe a course of antibiotics. Surgery to remove the tonsils is called tonsillectomy. Tonsillectomies may be used to treat frequently occurring tonsillitis, chronic tonsillitis, or bacterial tonsillitis that doesn't respond to antibiotic treatment. A tonsillectomy is usually done as a one-day surgery. A complete recovery usually takes 7 to 10 days. A condition of the immune system of serious concern is AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. It is the most advanced stage of infection with the human immunodeficiency virus, or HIV. HIV is a virus that kills or damages the cells of the body's immune system. By damaging the immune system, HIV interferes with the body's ability to fight the organisms that cause disease. HIV most often spreads through unprotected sex with an infected person. AIDS may also be spread by sharing drug needles or through contact with the blood of an infected person. In addition, women who are infected with HIV can give it to their babies during pregnancy or childbirth. The first signs of HIV infection may be swollen glands and flu-like symptoms. These may come and go a month or two after infection. Severe symptoms may not appear until months or years later. By the time AIDS develops, the immune system is severely damaged, making the patient susceptible to opportunistic infection, diseases that wouldn't normally trouble a person with a healthy immune system. A blood test can tell if the patient has the HIV infection. While there is no cure, there are various drugs that can be used in combination and are available, which can fight both the HIV infection and the infections and cancers that come with it. Today, individuals who are on medications can live with the disease for many years. Here are some key word parts for the lymphatic and immune systems, along with their meanings. In the third column, you can see some of the medical terms that we can create by combining word parts. You should return to the online medical dictionary to hear the pronunciation and become familiar with the meaning of the created terms. This concludes the lecture related to blood, lymphatic, and immune systems. In summary, we have discussed medical terms related to the blood, lymphatic, and immune systems. You should understand the meanings of these terms and be able to pronounce them. You should be able to describe common diseases and conditions, as well as medical and surgical procedures and medications related to blood, lymphatic, and immune system disorders.